Hi guys, welcome back to my channel. Today's video is going to be regarding PCOS, supplements that you can take for PCOS and some supplements that you can take for hair loss as well. All the supplements that I'm mentioning help with hair loss, and most of these supplements should definitely help treat the root cause of PCOS. So without mincing more words, let me get started. The first supplement that I take is from Hum Nutrition. Now, if this is showing reversed in the video, just look in the description box below and I will write the brand name and the name of the vitamin and the type of vitamin, just so that it will be easier for you. So Hum Nutrition, it's a gummy vitamin, and the name of this vitamin is Hair Sweet Hair. And it has biotin, folic acid, 40, which is a plant root based on my research, B12, zinc, and PABA. I don't think that supplements are the only way one should go about treating hair loss, but these are absolutely a must when you're beginning your journey to treat hair loss, because even if you go to a dermatologist, one of the first things that they will tell you is that despite the cause of your hair loss, unless it's autoimmune related, they will ask you to get on some type of a biotin and folic acid supplement. You must do what you can to provide the best nutrition you can for hair follicles, and this is a fantastic supplement to get on, and it actually tastes good. I am very picky when it comes to taste, so most of the supplements I'm mentioning are actually quite palatable. The second supplement is actually one of my favorite supplements, and I have absolutely seen tangible benefits with this. It's vitamin D3. Women with PCOS naturally have low vitamin D3. Low vitamin D3 is directly correlated to metabolic issues, as well as, well, insulin resistance is a metabolic issue. So it's directly correlated to metabolic issues. And women of color and women who live in cold climates where the sun doesn't shine too much definitely need to be on a vitamin D3 supplement and should be getting their vitamin D3 levels checked quite frequently. I was told last year from a blood test, actually not last year, it was 2018 January on a blood test, that I have low vitamin D3. I got on vitamin D3, you guys, and within about 3 months I saw an improvement in my hair quality. I kid you not. And for the past few years I had been getting sick with colds about every month. This year I didn't get sick at all since I started the vitamin D. So just for the general health benefits, in addition to having better hair and treating your PCOS symptoms, I would absolutely recommend this. And I also noticed that my skin is much healthier and much smoother. I recommend that you, for most of your vitamins, if you can, to take liquid vitamins, because it gets you the fastest results. I take 5,000 IU of this vitamin D3. I'll put the brand name down below. And within 2 months, my vitamin D levels were completely normal. The third supplement is actually quite popular among the sub-communities online that are trying to grow feminine curves. And this is Maca. This is actually a root found in Peru. It's grown at extreme altitudes in the Andes Mountains of Peru. And I was always told that, you know, this is an adaptogen, in the sense it naturally balances the hormones in your body despite whatever hormonal imbalance you have. I actually tried this when I was 20 because I wanted feminine curves. I actually took this for 4 months, and although I don't remember whether I actually got feminine curves, it was actually later down the line when I looked back and I realized when I took this was when I got my period for the first time in a year and a half. So let that sink in. This actually did the job. I actually wish I continued it long term back then. it probably would have done wonders for my body and treating my PCOS. But this is something I absolutely recommend. This is a natural hormone balancer, and especially for you ladies out there who don't want to try Western medication or prescription medication, this is definitely something to look into. So please talk to your healthcare provider about it. The other supplement that I recommend is vitamin B12. This is also a liquid vitamin that I take. It's freaking delicious. I like how the first thing I say is it's delicious. So research has also found that vitamin B is actually correlated to metabolic issues and insulin resistance as well. So taking a vitamin B complex, I think, is very important for women with PCOS. Absolutely does help with hair. And also helps with fatigue. And as we know, PCOS women tend to skew towards having lower moods. And those who have lower moods and those who are stressed quite a lot tend to have naturally low vitamin B type. So absolutely, I would recommend this. Please check it out. And I remember that before I started taking this, I would feel a lot of fatigue, and within about 6 weeks of taking this, I noticed that my fatigue was much better. The other more popular and research-backed supplement is Inositol. I've talked about this in another video, but there's quite a lot of research out there where they have given Inositol to those with diabetes, PCOS, metabolic issues, and there's no doubt that this lowers, not just this improves insulin resistance, but also helps improve testosterone levels in terms of lowering it for women. They also noticed that women who took this supplement and didn't make any dietary changes based on the research, if I'm remembering correctly, actually also experienced some weight loss from what I remember. I will check that again. But I clearly remember the research mentioning that Inositol is a power, well, I don't want to call it a drug, it's a supplement. It's actually a powerful supplement when it comes to treating insulin resistance. So if you don't want to go on metformin, this is something I would look into. This is from Jarrow's. This is actually one of the best brands for Inositol. And then last but not least, I recommend that you ladies get on some type of a fish oil if you would like. I think that our PCOS women's lipid panels tend to be weak. Again, there's a big relationship between lipid panels and insulin resistance as well. So if you can improve your lipid panels, there will be a good enough feedback loop where you start feeling like your insulin resistance is improving as well. And your fatigue is improving. Cognitively, I have seen a lot of improvements with this. The brand I'm taking is TheraTears, and this is actually to help moisturize your eyes. Although this is really an omega-3 supplement. It's not just for your eyes. You can take it for anything. I started taking it specifically, this brand, because I was having eye issues. But any kind of omega-3 supplement that's well reviewed would do. And this supplement is completely fine as well. This is highly reviewed, actually. Most of the people who take this for their eyes actually say that it helps with their lipid panels as well. So something to look into. So yeah, those are the supplements that I take. If you have any questions or comments, please let me know. I also want to add that, I'm not giving professional medical advice here. I'm not asking you or telling you to take certain things. This is what has worked for me based on my personal experience. So your mileage may vary. Please talk to a physician and make the decision that's best for you. Any questions, any comments, please let me know. I'm always responsive. I actually have an Instagram if you want to connect with me. So if you go to my channel's banner art, there's my Instagram account listed on the bottom of the banner. So please click on it and follow me, and you can DM me there as well if you wish. Thank you so much. Take care. Bye.